Hi everyone, I wanted to do a short video today on the COVID-19 vaccine and autoimmune disease based on the medications that you're on. So unfortunately, there's not a whole lot of data out there yet because it's such a new vaccine. But what we do know for the two approved vaccines in the United States, which is the Pfizer and Moderna vaccine, that it's a dead vaccine. So many times with autoimmune medication, dead vaccines are okay, and they're okay to be administered when you're on autoimmune medicine. That being said, with the data that we do have, which is quite limited at this time, we do know a few things. If you're on methotrexate, there has been some data out there showing that it might be beneficial to hold your starting of methotrexate up again for 2 weeks. So you might want to skip 2 weeks of your methotrexate after the vaccine. So that has been put out there. Also, if you're on high dose steroids, you might not be getting the complete benefits of the vaccine. So usually that's when you're on prednisone 20 milligrams or greater. That being said, again, if you have to be on steroids due to your medical condition, then you have to be on them. But if there is a way to be able to taper your medications and taper those steroids back a little bit, it tends to show that there is more efficacy with the vaccine. The third one is rituximab, which some of our patients are getting for lupus or vasculitis, or some for dermatomyositis or myositis and other autoimmune conditions like rheumatoid arthritis. And in those patients, because it doesn't allow your antibody response to be quite as strong as it usually is, if it's possible, there's some thought that maybe it could be pushed out a little bit if you're due for your next infusion and you're also supposed to be getting your vaccine. So for example, if you're supposed to be getting your vaccine and the week before you're getting your rituximab, you might want to wait on the Rituxan infusion if possible. Of course, consult with your physician and then get the vaccine, and later on get the Rituxan infusion. So that's what we know so far. I have gotten the vaccine. I do not have an autoimmune disease. I did receive the Moderna one. It was totally fine. I fortunately had no side effects whatsoever. It was very similar to the annual flu vaccine. Please message me below if you have any questions.